my name's Christian and I'm a fourth year medical student at Newcastle University. Last year I started making task trainers. These are models that healthcare professionals use to practice clinical procedures. For example, taking bloods or putting in a cannula or catheter. The use of task trainers in healthcare education is increasing because it allows procedural competence to be gained without risking patient safety. There's strong research that shows their use correlates with the reduction in complications from procedures, and this leads to improved patient well-being and clinical outcomes. The first task trainer I made was of the neck, and this was so that doctors on a local intensive care unit could practice emergency cricothyroidotomy and percutaneous tracheostomy procedures. While doing this, I learned three important things. Firstly, that commercial task trainers are relatively expensive, and this can put a strain on educational budgets, meaning that task trainers are often shared, overused, or not used at all, and this decreases the quality of the education delivered. Secondly, healthcare professionals have some really good ideas on how current task trainers can be improved, but they don't have the means to implement them. And thirdly, I learned that I was able to solve both of these problems. Compared to commercial models, I was able to make task trainers of a similar quality and functionality, but for a fraction of the cost. I was also able to quickly modify the task trainers in response to the doctor's feedback, tailoring it to their specific needs. I was able to do all this because of my innovative design and manufacturing methods, primarily the use of additive manufacturing, more commonly known as 3D printing. To do this, I take a CT or MRI scan of a person and use it to make a digital 3D model. I then manipulate the model, use computer-aided design software, and, when it's ready, I print it. 3D printing conveys many benefits. I can use real anatomy to make the models, and this maintains their realism or fidelity. The digital files can be easily modified and reprinted, allowing for rapid prototype test cycles and development, customizations, and variations to mimic the real anatomical diversity seen in clinical practice. It's also cost effective, which means I can offer the task trainers for an affordable price while still maintaining a healthy profit. It also means I can offer a unique service whereby I can make bespoke task trainers on an individual scale, including for relatively specialised procedures that don't currently have commercially available task trainers due to the niche market and normally high development costs. Overall, this means I can design, manufacture and sell task trainers that are high quality yet affordable and can be made or customised upon request. Therefore, I have the potential to improve the accessibility and affordability of high quality healthcare education. So far, I've been able to do this in 2 departments in 2 hospitals, but this is just the start. My end goal is to replicate this on a global scale by making more task trainers for more procedures and making them available worldwide. Again, the use of 3D printing makes this easier. New manufacturing hubs can be easily established with a small amount of equipment, and this means that new task trainers can still be designed and tested centrally, but once they're complete, the digital files and methods can be distributed electronically to all of the hubs so that the task trainers can be printed when and where they're needed around the world. So, in December 2020, I founded Medisim Ltd, trading as MediTask. The company began trading in January, selling task trainers directly to healthcare educators. As a company, I've been able to access lots of support. For example, business advice from the Newcastle University startup team, intellectual property advice from RTC North, and networking and contacts from Barclays Eagle Labs, amongst others. Just as importantly though, throughout my journey I've had considerable support from my friends, medical students, doctors and academics who have all been eager to help me progress my ideas. All the while, I've been continuing to research and develop new task trainers. Part of this is for an affordable material that works under ultrasound, and this has been successful in early testing. Winning this prize and accessing the funding will allow me to complete this. It means that I can make task trainers for procedures that require ultrasound, which are becoming more commonplace. The funding would also help me to rapidly scale up MediTask by hiring more designers, buying more materials and 3D printers to scale up manufacturing, and increasing marketing and improving the website, which will allow me to reach customers on a national and then international scale, and ultimately reach my end goal faster. Also, I believe with the support of the Institute of Global Health Innovation and Imperial College London, I can develop my ideas and ambitions further to maximise the positive impact that my innovations have on healthcare education and patient wellbeing globally. For example, by publishing the results of my research and testing to contribute to the evidence basis in this field. For more information about the company, please go to tasktrainers.co.uk. Please note, while this website is up and running, it is still under development. For any questions, please email me at k.nandapalan@newcastle.ac.uk. Thank you.